Good day everyone, my name is Robert James Torifiel, a student nurse of General Santos City Doctors Medical School Foundation Incorporated. And for today's video, I'm going to demonstrate administering intramuscular injection. So let's get started. So the first thing we must do is to assess for any allergies to the medication, so that we can avoid or prevent some complication or such as the anaphylactic reaction. So that's the reason why we need to conduct a skin test first before administering a drug, especially an antibiotics. Then after that is we are now going to assess the specific drug action and possible adverse effect and adverse reaction and side effect, so that we can able to know what are the side effects and we can able to share it to the client and what are the nurse and how to manage on that side effect. Then after that is you are also going to assess the client knowledge and learning, assess client knowledge and learning needs. And also, we are going to assess the tissue integrity of the injection site, so that if the injection site tissue is not compatible to the dosage, so that we can move to the other side, such as the gluteus maximus muscle in the gluteal. Then after that is you are also going to assess the client age and weight, so that we can able to know the size of the needle that is needed. Then lastly, we are going to assess the ability of the client to cooperate in the procedure, so that we can able to know if we need some assistance or not. Then after that is you are now going to determine the size of the muscle, whether it is appropriate to the amount of medication that will be injected. So if the muscle is not appropriate to the amount of the medication, we can move the site of injection to a appropriate one, which is the larger muscle, which we found in our gluteal. That is one of the example of this, our gluteus maximus muscle natin. So then after that is we are now going to assemble all the equipment that are needed. So we have here the medication administering record, the alcohol. We have also here sterile gloves, the 2x2 gauze. We have our vial, then our syringe, and lastly we have our antiseptic swabs. So we need to do this, we need to prepare all the materials that are needed, so that we can less likely to waste time and we can avoid committing errors. Then after that is you are now going to check the medication administering record. We must check the label of the drug. We must follow the 3 check before getting it from the cart, before withdrawing the drug, and also after withdrawing the drug. We must also confirm that the dose is correct. So we need to do this so that we can make sure that our carrying out medication is for the correct patient. Then after that is you are going to organize the equipment that are needed, so that we can less likely to waste time, which is I already done. I already organized the equipment that are needed. Then we are going to perform hand hygiene, so that we can less likely to harbor microorganisms and for infection control. Then we are going to prepare the medication for drug withdrawal from the vial. Then after that is we are now going to provide privacy by draping the curtain. So we need to do this so that we can able to gain trust to the client, and the client will be cooperate in the procedure. So after providing privacy, we are now going to prepare the client. So first, we need to introduce ourselves to the client and verify the client identity. So good afternoon, sir. I am your nurse for today. I am Nurse Robert Ching Sorihel, and you are? Oh, Papa Bear. Good morning, Papa Bear. Again, I am your nurse for today. So we need to do this so that we can establish rapport to the client. Then after that is we are now going to assist the client in a appropriate position so that we can, sir, magtanong lang kung sir ha, position nato, sir, okay lang. So we need to do this so that so that our procedure can be done smoothly. Then after that is we are now going to obtain assistance for uncooperative clients so that again we can less likely to waste time and we can done our procedures smoothly. Then after that is we are now going to explain to the client the purpose of the intramuscular injection or intramuscular administration. So, sir, kanya nga ito ang i-administer sa inyo. Karon sir, mo ni siya ang ginatawag na Pfizer nga vaccine. Mo ni siya ang vaccine, sir, para mapalayo ta or ma-prevent nato ang magkaroon ng COVID-19, sir. So, okay lang sa iyo, sir? Sige, sir. And after that is we are now going to select, locate, and clean the site. Select a site that is free from lesion and swelling because it can be an hindrance in absorption of the drug. Then after that is we are now going to locate the exact site for injection. So we need to locate from its acromial region. So probably here. Then after that is we are now going to put on our gloves so that we can protect ourselves. So after putting our gloves, you are going to clean the site with antiseptic swab and allow to dry through. Then after that is you are now going to place and hold a dry cotton ball between your third and fourth finger with your non-dominant hand. That is, we are now going to prepare the syringe of medication. We are going to remove the needle cap while waiting for the alcohol swab to dry. Then we are going to inject the medication. Take note in injecting the medication. At first, when you already inject the needle to the site, we need to aspirate first. If there is a backflow of blood, then and the syringe, we need to pull back the syringe because we inject our needle to the incorrect spot, which is in the blood vessels. So we need to do is to aspirate first so that we can able to know if the injection is in the appropriate site or appropriate location.
Right. Inject the medication. Grasp the syringe with your dominant hand between thumb and fingers, with palm facing to the side or upward for a 45-degree angle insertion, or with a palm downward for a 90-degree angle insertion. Prepare to inject. Using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and firm, steady push. When the needle is inserted, move your non-dominant hand to the end of the plunger, then inject the medication by holding the syringe steady and depressing the plunger slowly, even pressure. The needle should be unbended with the skin for 5 seconds after complete depression of plunger to ensure complete delivery of the dose. Then we are now going to remove the needle. Remove needle slowly and smoothly, pulling along the line of insertion while dressing the skin with your non-dominant hand. If bleeding occurs, apply pressure to the site with dry, sterile gauze until it stops. Then we are now going to dispose of supplies appropriately. Then remove gloves and perform hand hygiene. Then last.
So after removing our gloves, we are going to do hand washing again or hand hygiene. So we can prevent cross-contamination. And then after doing hand hygiene again, we are now going to document data, document the medication, the time, the route, and any nursing assessment. Because if it's not documented, it means it didn't happen. So we're done. So thank you, sir, for your cooperation. And thank you for watching.